Medical professionals of Reddit, what's the most obvious case of faking it you've witnessed? Please like, subscribe and comment so I can create more videos for you. I commonly have young kids who really want glasses because some of their friends have them. They'll come in acting like they can barely see the biggie on the chart. I change some lenses in front of their eyes, give them a little encouragement that they can see better, and they can magically read 20/20 with little to no prescription. They're not big fans when I tell them they don't really need glasses. Heck, I was the opposite. All the popular girls were getting glasses, so I told my mom I needed them too. Go to the optometrist and hug. I'm hella blind. Turns out my dad was actually pointing out deer by the side of the road, not just teasing me. Turns out you can see individual leaves on a tree, not just green lumpy blurs. We have a patient at our primary care clinic who claims to be blind. He always comes in with sunglasses and a white cane. We were always suspicious though. Something definitely seemed off. One day someone followed him out of the building. He walked through our nearly empty parking lot, and down the street a little ways to a car parked out of view of the clinic. He folded up his cane, got into the driver's seat, merged into traffic and drove away. I just want to tell him he has tumors in his eyes and they had to be taken out, but since he's blind he wouldn't miss them anyway, just to see his reaction. Called to a bar for a seizure. Waitress says she delivered his bill and he suddenly went to the floor having a seizure. Look over at him, and he's laying there flopping his arms and legs around, as he looks us right in the eye and screams over and over, "I'm having a seizure." We tell him to stand up so we can take him to the ambulance. He doesn't, starts walking to the door. We tell him to hold up, gotta pay your bill first. Man, was he pissed at us. Waitress tells us he does this all the time. Well, not today. He still took a ride to the hospital though. The hospital has good egg salad sandwiches. Not quite the same thing but in the air. A woman came claiming she was in labor, so got her on her way to L&D. L&D sent her back saying she was faking it and needed to go to the psych ward. Quick physical exam showed that was false because the baby was crowning. Sent her back to L&D and from what we heard baby was delivered in the hall on the way there. My mom had a patient who said she had past kidney stones at home and needed painkillers. The lady actually brought in the kidney stones as proof. Patients don't usually do this, and the stones were way bigger than people can pass on their own. My mom sent them to the lab and they came back as geological origin, aka, crazy lady picked up small stones from outside to try and get meds. Veterinarian here, for something different. Performed a cruciate repair on a miniature poodle, and of course the dog limped post-op. Came in for radiographs a month later to confirm healing, looked great, but dog was still limping. 2 months later, the owner was furious that the surgery was a waste of $1,000, threatened to sue, but on examination and re-radiographing the leg I couldn't find a thing wrong. On a hunch, I asked the owner to leave the dog with me for additional tests that would be of no cost to her. So she went shopping for an hour. During that time, I set up a video camera to record the dog in the kennel run. The moment the dog didn't hear the owner or the car anymore, boom, all 4 legs working like a charm, dog running around perfectly normal. Called the owner and asked her to return after half an hour, set the camera to record again, and the moment the dog heard the familiar car returning, the limp came back as well. I had a fun few minutes explaining to the owner that her dog was faking the sore leg for attention. Got a usual "oh no. My fur baby Snooky Wookums wouldn't do such a thing." So I showed her the footage, clearly showing her dog running around fine, as well as showing what happened when her car returned. Instructed her to ignore the dog while it was limping. Limp magically went away after a week of not getting attention for it. I had a woman come into Tridge in labor and delivery. We ruled her out for breaking her water. She was pissed that she wasn't going to get induced and be delivered. So after I left the room she flooded the bed, the floor and herself with tap water. Literally gallons and gallons of water, it was leaking out from under the door. So much water, it was like that scene in Comheads. She said it was her water breaking. Again quickly ruled her out and told her she needed to go home. She subsequently peed the bed before leaving. Yikes. How far along was her pregnancy and why did she want to be induced so badly? When I wanted to be a physical therapist, I volunteered at one of my local clinics. We had a lady who claimed she was in excruciating pain. She couldn't walk more than 5 feet without literally screaming in pain in the clinic. She couldn't even move her toes without yelling profanities. She kept talking about how her meds ran out and needed more. She also started talking about how her whole family thought she was an addict, but she swore wasn't. I started feeling for her a little. She seemed nice and like she was going through some mess. But then once the doctor walked out of the room, her and I got to talking about music. I told her my uncle was in a bluegrass band and she mentioned how much she loved bluegrass. She loved it so much that the prior weekend, her and her husband spent 14 hours at a festival. She was tired, was carrying chairs around and dancing. And they were traveling to go to another one the day after her appointment. When I asked her if she had any pain during the festival, she said, "Oh, none at all." It was a fantastic weekend, and then realized she gave herself up and got real quiet. When they told me they were allergic to Tylenol, acetaminophen, but Vicodin works really well for them. I'm sensitive to opiates, they make me puke, and have endo. When I went to the for suspected ovarian torsion, I said, "Yeah, look, I'm gonna need some ondansetron with the endo you've offered me because otherwise I'm going to vomit." They were suddenly reluctant to help me manage my pain with medication. I understand why, but it would have been nice to actually get pain relief. It's not my fault that I know what my reaction to common pain meds is. I worked as a nurse on a cardiac floor. Chest pain was the biggest thing people would use to drug seek, because if nitro isn't working we also give oxygen and morphine while turning it into an emergent situation. We even have an acronym for it. MONA, morphine, oxygen, nitroglycerine, aspirin. All are interventions for a heart attack. When you have a heart attack, your cardiac tissue releases these markers. Kind of a distress signal. We can pick these up on a blood test. Sometimes a heart attack can be seen on an EKG. If a patient had a history of negative tests and or multiple admissions and all their vitals were normal and I expected they were faking it, I would ask them if it hurt when I put my hand on their chest. They would always say yes, and then I could happily inform them that this likely wasn't cardiac but muscular pain, since heart attacks won't cause pain when your chest is touched. I would suggest a warm compress and some Tylenol, and their pain was always mysteriously gone within seconds of my announcing that it couldn't possibly be related to your heart. Woman shrugging. After a while you do get very used to the signs and symptoms of people actually having a heart attack. There's just no faking that level of panic or the look on their face. I had an attack of acute gastritis once that presented all the classic symptoms of a heart attack: shortness of breath, pain in my left shoulder and chest radiating down my left arm, etc. In the they checked me out thoroughly and could not find any sign of heart trouble. The pain persisted even after they gave me morphine. Finally, they gave me some sort of stomach antacid intravenously. I had already taken Pepto-Bismol earlier in the evening. The pain almost immediately subsided. They kept me overnight for observation but said my heart was perfectly healthy and that gastritis can sometimes feel like a heart attack. My mom had a frequent flyer at the emergency room she worked at. This lady was constantly in unimaginable pain over everything. She got a splinter in her finger and that constituted a 10 on the pain scale, and she needed painkillers to deal with it. She was a known drug abuser as well. She had been caught stealing needles and shoving them up under her huge sweaty boobs. The only reason my mom found out was because she came back in to place the EKG pads, and to do so, she had to lift her boob up to place the pad. When she did, the needles rolled out. From that point on, they had to have a member of security watching her anytime a nurse or doctor left the room. She also had a massive arrest record, and there were times the cops would bring her to the ER instead of an ambulance. Not a medical professional but work security in an ER, once had a guy come in, announced that he was going to have a seizure, then lay down slowly and comfortably in the floor and didn't start seizing until he was sure everyone was looking at him. Then when the nurse, who knew he was obviously faking, said they were going to have to run a tube down his throat, he was suddenly fine. We have patients that will do this at work. One guy will lower himself to the floor and kick his legs while saying, "I'm having a seizure." It's kinda funny. A surprising number of people try to fake being unconscious, but there's a simple test for that. Pick up their hand and drop it onto their face. If they smack their own face, they're unconscious. If they move their hand to the side as it drops, they're conscious. Pediatrician here. So my patient was younger, and I think influenced by mom. This 13-year-old kept getting admitted for complaints that never made sense. Lack of smell. Dizziness. Seizures that would happen while he was walking, running. Heart felt hot, etc. Every specialist under the sun had seen him and cleared him. He had every test and imaging study you could think of. There was a lot of social stuff going on and this was a hard family to discharge. He'd get admitted, we'd run 100 tests, and as soon as we were about to discharge him, some new symptom would come up. The worst was once after I had already written the discharge orders and the nurses called to let me know the patient had gone blind. I was grouchy that day and wasn't having it. I went in with a rolled up piece of paper. I checked his pupils. I used a Snellen. I went through the whole rigmarole. Then when I was talking to his mother, without looking I threw the paper at him hard and fast. He yelped and dodged it. I told mom that they were going home. To be honest, I still feel a little guilty about it, and don't know what the right thing to do was. I have a distant cousin who pulled the "I went blind" as a young teen. Managed to trick a GP and be sent to a specialist who had to carefully explain to their father that the kid was faking it. It's been a solid 15 years and the dad is still pissed about it. I posted a while back but will post it here again. It wasn't super obvious at first, but after looking into her records it became clear. So this happened a few months ago on my psychiatry rotation in medical school. There was a patient at an inpatient psychiatric facility for suicidal ideation. She constantly insisted that she had a mass on her breasts and demanded to be physically examined only by male doctors. When the psychiatrist I was rotating under declined to perform a physical exam, she asked me to do it during my daily patient interview. I also declined physical exam, but had a bit of a hunch to check her medical records. It turned out she had an ultrasound done a week before that found only normal breast tissue without masses. However, apparently this lady had frequented many doctors' offices with various complaints of an unspecific nature and would usually focus on breasts or vaginal complaints when she visited male physicians' offices. We diagnosed her with factitious disorder, formerly known as Munchausen syndrome, and histrionic personality disorder. It seems her goal was mostly attention from medical professionals. She had lots of issues, but we also had to be careful to make sure she wasn't fishing for a lawsuit. Patients like her are why doctors document everything meticulously. Dude had severe and permanent back pain. He was prescribed Vicodin and he mysteriously ran out halfway through the month, consistently. Obviously dude is taking extra, right? He's acting clueless and is beside himself when we tell him our suspicions. Through this entire time his wife is his biggest advocate, even when he says I don't really need it. I'll survive, his wife is having none of it. She is his biggest support. Ultimately we decided to take away the Vicodin and his wife immediately thunders I need my fucking Vicodin. Oh yours huh, she sold herself out. Lady kept putting cut up plastic pieces up her uterus. You read that right. Not in the vagina, the uterus. Wanted to be perceived as a medical mystery. Surgery to remove it. Complains of more plastic coming out hours later. Doc says I took pictures, there is no more plastic, tells her to stop doing it. She requests a new doctor, and another surgery occurs. More plastic. And X200B. This is called Munchausen factitious disorder. Incredibly frustrating to deal with as a provider. As someone who has had an IUD shoved through her cervix, this sounds like a fucking nightmare. A bit late to the party. I had a patient who was supposedly comatose but was giving a few mixed signs when it came to making a definitive judgment. There is a test called a drop arm test, where you raise the patient's arm over their head and drop it. A non-comatose patient will move their arm on their own to avoid hitting themselves in the face. But I had a different idea. With the nurse in the room I said, "Okay. Our defining test. If his arm stays straight up unassisted he is comatose." I let go of his arm and it stayed totally upright. The guy did himself in. I told him shortly after that the gig was up and he had no medical reason to be admitted. My grandma used to work with a lady at a hospital, funny enough, that would always say she got an on-the-job injury and needed to take a few weeks workman's comp. A doctor there would somehow always give her a note and she would get a free week or two vacation, come back for a month, and do it again, obviously milking the system. One day her boss said, "Okay, but there's nothing for you to do here on light duty. Usually we'd send you home until you're better, but we're going to have you come in until you're better. But there's nothing for me to do," she said. He told her, "I know, bring a magazine or something. It'll be a long day sitting in the break room." She lasted 2 days and never pulled that stunt again. This reminds of boredom rooms in Japan. Layoffs taboo. Japan workers are sent to the boredom room, the New York Times webpage. When I was a labor nurse, the emergency room sent up a gal who said she was in labor. She was a sturdier lady so it was hard to tell. No prenatal care. No fetal heart tones. Did an ultrasound. She'd had a hysterectomy. She and her partner insisted we were wrong because they prayed and knew they were having their miracle baby. Good luck with that, mom. This person had a long mental health history. I have no doubt that she believed she was pregnant. We had a patient come in on a workers' comp case with severe injuries to the chest. He states that while working in a grocery store parking lot, a female deer spots him from a distance and decides she wants him. Once she gets close to him, she kicks him in the chest several times and then headbutts his kneecaps in. Once he's on the ground, she stomps on his chest and head. He wakes up several hours later and immediately comes to us. Not only was his story completely ridiculous, but he didn't have a single mark on his body. No bruising, no swelling, no broken bones. Just nothing. He rated the pain at a 10/10 without a single scratch on his body. Needless to say, he got his claim denied. I knew this was going to be good as a female deer spots him from a distance and decides she wants him. I am kinda late, but I am an X-ray tech, and when I was a student these two people came in, a man who was pushing a woman on a wheelchair with an ankle boot. They both looked like junkies. Anyway, they came in with a prescription for an ankle X-ray. They asked if she has to take off the boot and I said yes, because obviously it would superimpose on the anatomy. She all of a sudden starts crying, saying that it was too painful. No tears. The man said she broke her ankle in 3 places some time ago and her ankle becomes curved when she takes the boot off. Okay dude, ankles raise are easy, take off your shoes and socks. 3 views, boom, done. But no, says she cannot get on the exam table and she needs people to hold her ankle together. We literally had 4 X-ray techs working this high-profile case. 1 to hold the digital cassette, 1 to hold her ankle in place, 1 to hold the chair we had to put her ankle on, and 1 to push the button to shoot. We did this all while she was screaming in pain and she even said kill me please. The funny thing? All the X-rays showed no abnormal findings. No old fractures, no screws or plates of any past surgeries. Literally a perfect intact ankle. They wanted painkillers for sure. They looked like drug addicts and had a plan to get more. So annoying. Edit, grammar and spelling. Had a frequent flyer patient who did have some legitimate medical issues, but you could tell that there was more to it than that. Patient would tell us to push IV narcotics as fast as possible because it works better. Also had the usual I'm allergic to every single week a painkiller but dilaudid story. I suspected they were also fudging some admissions information, was making the rounds at area facilities, But that's another story. And X200B, patient had to self-catheterize due to a bladder problem, but would regularly come in with raging urinary tract infections. While catheters can cause UTIs, the frequency and severity didn't seem to add up, on top of the other questionable aspects of this particular patient. Turns out, patient was putting their feces on the catheters before inserting them to cause the infection so they could come into the hospital for meds. Had a patient arrive to my unit thrashing around on the stretcher and saying I'm having a seizure, I'm having a seizure. Transport, and I moved her into her room and I told her to call me when she's done. Amazingly, she was cured. Sounds like Dora. Just narrating everything. Next time it'll be I'm unconscious. Not a medical professional, but when I was visiting a small town in North Carolina I had to go to the ER because of a kidney infection, and I remember out of nowhere they did this thing where they placed a fist on my kidney and lightly punched it with their other hand, and the pain was so searing and awful that I just screamed and cried. They told me it was to make sure I wasn't faking it for the medication. Ah, yes, testing for costovertebral angle tenderness. Even a tiny, light thump over the affected side will make the person do what you describe. Pretty old school but super effective. Anything related to a fake seizure. That's the easiest thing to call shit on and nobody will take you seriously. Had someone fake seizures? Would be talking normally, stop, shake briefly, stop and then peek at me to see if I was watching. I believed it initially until I called the MD and they came in while the patient had another seizure. Doctor picked their arm up over their head and instead of the arm falling on their face it changed course to avoid slamming into their nose. Is this really that effective? That is. Are these fakers really that stupid? When I was a little shit in middle school I would fake sleeping, and when my parents tried the arm thing I just let it smack my face. If a snotty 12-year-old can avoid getting caught like this, I'm surprised adults would. Got called for a seizure to a park well known to be full of homeless drug addicts. We walk up and there is a man, laying in the grass in no distress. As soon as I say hi there he starts shaking his whole body and yells, "Oh no, help me, I'm seizing," and his friend says, "I think you need to give him some Ativan for the seizures." Had a PT come in with uncontrolled diabetes. He was type 1. His BSL was really high. A couple days and it was back under control and he was ready to be discharged when they went out of control again. Those pattern continued. About 7 AM one morning his girlfriend fronts me needing a note for the judge. He was supposed to be in court at 8 AM. He'd been eating wild amounts of food to try to get out of going to court, then wanted us to fix the situation with 1 hour notice. We did nothing. He went home about 11 AM. I am a firefighter and we have quite a few calls about people faking medical problems. The most obvious call that I have ever been on when someone was faking was a woman that looked to be in her 20s super drunk. The first call we had was about 1 PM. We arrived on scene to this woman having seizures, but we could easily tell she wasn't because she was making direct eye when we were talking to her and she was even responding to our questions while she was having one of her episodes. We never come out and say that you are faking, but we do ask if you are pretending to have seizures, and if you say no then we do our best to try and make you go to the hospital. Well, her family and her said that they will just keep her home and watch her, and if it happened anymore they would just take her to the hospital theirself. We had another call from the same address about 3 hours later for the same female having seizures. So we arrive on scene again kind of pissed since she woke us up for having pretend seizures again. When we walked back in the house she was laying in the floor again flopping around like a fish in a sea of all different kind of alcohol bottles. This time she gets an attitude with us when we ask her if she was really having a seizure, and we weren't having any of it. My captain got on the radio and called to have a deputy come out and assist us with dealing with the crazy wasted lady. Next thing you know, when the deputy pulled up in the driveway a few minutes later, she was up running around screaming at everyone because she said that we aren't giving her all the medications that we are supposed to give her. So long story short, she was told she could either go with the deputy to jail or she could go with the ambulance. She said that she would rather go with the ambulance. When we got the stretcher brought inside for her, she started saying that it was all a joke and that we needed to get the hell off her property, but she then got into one of the paramedics' face and started screaming swears at her, so we all got a hold of her and put her on the stretcher and then strapped her down with all the straps that we had just to keep her still. The deputy said that we better take her to the hospital just to get checked out, so that is what we did, and she screamed and cursed at the paramedics all the way there. And X200B. Not exactly faking it, but funny story. When I was working in the hospital, a patient's screen with his vital parameters started showing dangerously low levels of oxygen in blood, which basically means somebody is suffocating in a way. So all alarms go on and the nurses and one doctor rush to the patient's room while the CPR mode is active. Surprisingly, the patient was looking all well and didn't show any blue skin, sign of deoxygenate blood. He was even smiling. So everybody just confusedly went on with their business, except for this one sister that grinned at the old man raising her finger, saying, "Oh Mr. Smith, did you hold your breath again to see how fast the oxygen levels drop?" And he just started grinning like a 5-year-old and nodded. One of the funniest moments. D. I've had asthma my whole life, and one time at the hospital for an extended stay for an asthma attack, I apparently also learned this was a thing and would hold my breath. I would apparently chose to do it when certain nurses, doctors that I liked were working to come say hi and to show off the blinking lights in my room. Had a prisoner once that was faking full amnesia including name. I told him there was a nerve in his ear that if he put his finger in his ear and couldn't remember his name, that he was for sure faking, because it even worked with severe dementia. Finger in ear, remembered name, finger out of ear, can't remember who he was. Insta discharge back to jail. I was a combat medic in the army and faking an illness or injury is extremely common. But I always gave it a pass because unlike any other job anywhere else, getting a sick day is damn near impossible. At least in my unit. So if you came in with a fake cough or told me you had the shits, I would tell our PA to give you 2 days of bed rest. He didn't give a fuck and did whatever the line medics asked him to. The real crazy shit is from people who you know are faking and trying to get out on a medical discharge. These are almost always people in their second enlistment, because after 4 or 5 years in the army they know how the system works. We had a fellow medic do this shit. He was a former Navy corpsman who re-enlisted in the army as a medic. He was also a real shitbag. Schmozzed with the right people in the platoon, so no one never knew where the fuck he was half the time. Usually he was sitting at his house on base playing Xbox with his wife. Personally, I'm under the assumption that he re-enlisted solely to fake a service-connected injury so he could get out with full disability. Anyway, we were an infantry unit about a year out from a deployment to Iraq when this guy showed up. One day we were holding some training for the Joes using CPR dummies. Some of these dummies were over 150 pounds and used to simulate carrying dead weight. We were moving them around the area when we heard a crash from the other room and a loud scream. We rush in and Navy corpsman was sitting there holding his arm and wincing like he got hit by truck. He made up some vague story about pulling a muscle when the dummy fell or some shit. For the next month or so this guy would walk around with his right arm, held out bent at the elbow, L-shaped, with his palm up and his hand frozen like a claw. Imagine your arm in a sling but twist the hand into a claw and hold it palm up and you get the idea. It was fucking hilarious. One day he gave my buddy a ride in his car and he used his good hand to put his clawed hand on the shift between the seats and used his good hand to pull that hand so he could switch to D. I'm laughing just thinking of my buddy laughing his ass off telling me this story over beers later that night. This fucking guy milked that shit for everything it was worth. His fake injury gave him the perfect excuse to fuck off. I'm at the hospital or I have an appointment with orthopedics or some other shit. He eventually did get his medical discharge, which meant he had another reason to fuck off because he had all sorts of appointments with the discharge people. And the rest of the platoon was too busy getting ready for a combat deployment to babysit his ass, so, whatever. I always figured that if someone is in the military and wants out, it's better to give them the boot. Keep them in and all it does is fuck up morale because all they do is sham and complain. You get an older guy doing this shit, it puts bad thoughts into the younger newer guys. So fuck 'em. Get them outta here. I don't care. The only thing that bugs me about this guy is that I know that this dude used every piece of knowledge he had, which was actually pretty considerable, to get more disability than dudes who got fucked up on combat ops during our deployment. Pro tip: if you're in the military and want to know if someone is fucking off, call them up and ask them where they are. 9 out of 10 times they'll ask where you are before answering. That way they can say they're somewhere else. I mean, you don't want to say you're at the company CP when the guy calling you is standing right in front of the company CP. Oh gosh. I'm a paramedic and can't count the number of patients I've had that fake seizures, or fake being unconscious. It is absolutely sickening. A lot of times it's for family sympathy, but sometimes it's just for attention in general. It's insane. The one test I do that always gets the unconscious ones is the gurney drop. I sit behind them for a minute, long enough to let their guard down. Then I push the lever that drops the head of the gurney back so they go from sitting to laying in a split second. That moment when their upper body falls out from under them will always elicit the "oh shit" response, where they throw their arms up and open their eyes. My favorite trick when I suspect a patient had a fake seizure is, I ask them to show me what the seizure looked like. If they start demonstrating, they're full of it. Real seizures won't be recalled as you're unconscious during. When I was a resident, I had a patient I was covering but hadn't personally seen start having a seizure. I go to the bedside, verbally order 2 of Ativan. As soon as I say Ativan, he pipes up, while still shaking, and says no, Dilaudid works better. He got neither. Not a medical professional, but a co-worker of mine. Let's just call her Linda. Was involved in a minor car accident. Her car was able to be driven away, went to the doctors and must have laid it on thick to try and get some sort of compo payment. Came back to work cause obviously the doctor wasn't having her bullshit, but played the victim for months on end, until I'm guessing her insurance compo failed to pay out, claiming that her spine was no longer connected. I called her on it too, said, well Linda, you're doing okay for someone who should be at least paraplegic if your spine isn't connected. She just gave me a dirty look and said, that's what the doctor said, my spine isn't connected anymore. And I just stand there looking at her like while the supervisor panders to her every need. Oh, don't worry Linda, everyone else can pick up extra work. Oh no, don't try to pick that up, just sit down, you just relax. So my dad told me a crazy story about when he was working at the local jail, as a jailer. This inmate had been acting weird and said he fell and paralyzed himself from the waist down and needed to go to the hospital ASAP. So my dad and another jailer took him to the hospital, local hospital that was down the road from the jail, and sat with him waiting to see. He was being really antsy and whatnot but kept his act up. Then the nurse insisted he needed a catheter just in case because he was unresponsive from the waist down. He hesitated but continued the act. When the nurse inserted the catheter he winced and howled in pain. Turns out my dad was right. He was faking it, and he paid the price for that one. Apologize for any typos, not wearing my glasses lol. I used to see kids faking it a lot to avoid going to school doing homework back when I was rotating in pediatrics. Best one was a 11-year-old who had read every symptom of appendicitis and regurgitated it as a medical student would in exams, and he didn't even have fever and his USG was normal. He could have won an Oscar for the acting though, including that small moan when examining the abdomen and checking for rebound tenderness. Not necessarily faking it, but I work at an clinic and definitely memorable when a patient asked if we would fill out an FMLA form for her period week every month. Like if you are actually so debilitated, which can happen, that is definitely something we need to address, and first step would be to get on birth control. Didn't want any sort of assessment or to start trying treatments, just the form so she could get out of work every month. And surprisingly we denied that one. Not a medical professional. I was thought to have been making my symptoms up. That it was all in my head. 2 years and a mess load of doctors later. Turns out I have a muscle disease. So apparently I'm really bad at having a disease. I know even the doctor that found it thought I was faking it. He apologized profusely and sent me to a specialist that deals with rare muscle diseases. I developed chronic arthritis as a teenager. Being the slight nerdy annoying type, they had legitimate reason to think I was faking. But nope, just actual chronic arthritis. I wish I was faking. Not a doctor, but one night I was in the waiting room at the ER. In hobbles this girl crying and carrying on like she was dying. She tells the nurse she was hit by a car and needs to see a doctor right away. She keeps emphasizing how she needs something for the pain. The nurse tells her how many people are ahead of her and tells her to sit down. She starts crying even louder. OW, it hurts. Please help me. I can't wait that long. I think my leg is broken. Just sobbing and weeping like an actress in a B-movie. She carries on like this for a whole hour as more and more people are called up ahead of her. Then she's talking on a cell phone, just loud and obnoxious. I'm at the hospital. I got hit by a fucking car and nobody's fucking helping me. Nobody cares that I'm practically dying. Finally, somebody goes in who arrived after she did. She jumps up all mad at the nurse and goes stomping forward and pointing. I was here before she was. I thought I was next. The nurse just looks down and says, I thought you had a broken leg. The girl realized she was busted. She told the nurse to go fuck herself and stomped out. Lady in the chair next to me tells me she saw that same girl doing the same shit at the downtown hospital a few weeks before. Apparently she just wants opiates to sell on the street. Husband is a doctor waiting for his residency to start. Last year during a pediatrics clinical rotation he had several parents who has clearly coached fire kids into faking all sorts of idiomatic aches and pains in order to get the doctors to prescribe opiates. My ex-uncle told his kid to tell his mom that her boyfriend was touching him. When she asked where he paused and said my elbow. I worked in an ER, and one day a guy came in by ambulance with his whole family. Supposedly he was having a seizure, flopping around and moaning. Doctor immediately says this isn't real. I don't know why he's doing this. Upon hearing that, he stopped flopping and moaning. He was silent for a second. Then, he opened his eyes and went, my head hurts. LOL. Some details changed for privacy. Not a medical professional, but when I was a teenager I had this friend who would literally fake seizures. At first we took it seriously because my other friends and I were young and didn't know better. She only did this when other people were around to watch and to sympathize with her. We would just stand there and watch, she wouldn't even shake, yet she called them seizures. Eventually we smarted up and realized she wasn't even doing a good job of faking. Especially after she was taken to the hospital, we tagged along because we were sleeping over, and we witnessed the doctor telling her parents that he doesn't know what's going on, but her body shows no signs of having a seizure. That person was fucking weird. Kids do really weird shit for attention. Had a friend in middle school who tried to convince us she had stage 4 stomach cancer. Not a doctor, but I am sure people with stage 4 stomach cancer don't usually have perfect attendance or play on multiple actual sports teams. Getting pages that patients state they are in indescribable agony and screaming non-stop, then going outside their room and listening a bit while they joke and laugh with their family, only for them to start screaming again as soon as I walk in the room. I'm disturbed by the number of adults who don't realize that most rooms aren't soundproof. If you try and fake a seizure or unconsciousness, we'll know. You may be really good at not reacting to pain when I sternal rub or pinch your nail bed. But no one can willingly let their hands drop full force onto their face, or not flinch when I suddenly squirt a bit of saline at your face. I don't attempt the hand dropping thing while in public. It would look pretty bad to make the person slap themselves if it turns out I'm actually wrong. My son used to ski like he was indestructible, and would always get far ahead of me. One time I caught up to him, to find him wrecked and crying. The ski patrol took him to their medical building, and privately told me that he was fine and faking. I made him climb into his bunk bed that night. In the morning I took him to the doctor, just as a precaution. The doctor thought he was faking too, but ordered an x-ray, just in case. That x-ray showed he'd broken his femur. I felt so horrible, and I don't think I've ever felt any better even though that was 15 years ago. Listen to your kids, people. And I'm so sorry, little Bobby. Well, not a doctor, but in school a friend decided he had enough of it for the day and go to the infirmary pretending he was blind. I was in the infirmary for a cut, so I watched the whole thing. At first he pretended he was blind from both eyes. After the nurse asked how he get to the infirmary alone, he changed to only the right eye. She goes to get a flashlight and when she asked again he said it was the left eye. Then she moved a finger in front of him, and both his eyes made the following movement. She placed a band-aid on his forehead, moved to treat my cut and said to him, "I fixed your mind's eye, you can go back to class now." Literally every day. Fake seizures. Fake syncope. Fake chest pain. The list goes on. Crazy. I actually just got out of the hospital and am reading this in bed. I should have gone to the hospital Monday when I had stabbing pain in my left side that doubled me over and made me puke, but I have an irrational fear that doctors are always going to think I'm faking and yell at me for wasting their time. So I psyched myself out and convinced myself that I was overreacting and the doctor would think I just want drugs or something, but I still felt like shit today, so I forced myself to go. The doctor was very nice and it turns out I had passed a kidney stone on Monday. He sent me home with a note keeping me out of work for the next couple days and a small prescription for Vicodin. And told me from now on if you're in so much pain it's causing you to double over, just go to the damn hospital. Had to take a patient for a test. Patient stalls in every way possible. They even go as far as to say they are short of breath. After checking their O2 stats it turns out the patient is just fine. He grumbles as he sits in the wheelchair. This happens quite a bit. Some of these patients act worse than 3-year-olds who have to be in bed by 9 p.m. I had the weirdest, most terrible back pain earlier this year where my left torso would burn and just started to feel like it was slowly being crushed and it eventually would affect my breathing. I was so terrified that nobody would believe me that the first thing I'd say to every doctor was, "I don't want pain meds, please help me figure this out." I begged for a blood test because they were so dismissive and I was terrified that it was pancreatitis or something. It lasted for 2-3 weeks. Was told it sounded like shingles but a rash never materialized and eventually it got better. If I bend over for a long period it starts aching in the same spot to this day, but who knows? People who fake these things ruin it for those with real issues. I've worked at a hospital for about a year, so I've only had 2 cases where I knew a patient was faking it. The first one was a young male patient who had an abscess under his arm and demanded inpatient treatment. He did not. I don't know why he was admitted. He refused to let a nurse put in a knife, so we had to call RRT, rapid response, to put in a knife using their ultrasound. Complete waste of resources. We use this for patients who are old with poor veins. I took him to the shower and he says he's dizzy. I go to walk him to bed with the gate belt on and this man fucking drops. It was 100% a fake fall with the way he fell to his side to protect himself from belly flopping the floor. Then he fakes being unresponsive. We call our RT and the fall team to come and assess. Fun fact, this patient fakes 3 falls in the week he was in the hospital. This patient was a complete waste of a bed and resources. He was telling me he was a medical assistant but now he's on disability, in his early 20s. When he walks fine. Which is kinda a red flag for Munchausen's. Surprise surprise, he is back a few months later with the same issue. Surprise surprise, he falls twice more during his stay. House doctor started charting that they were purposeful and so they didn't count to it for floor fall count. Second one was a few weeks ago. Lady comes in with pseudo seizures as she states. She literally said she has fake seizures. Okay. So she seized in the room. RRT is already on the floor so they come and check it out. This woman doesn't even jerk right. She looks like she's grinding doing the worm, in the bed. RRTRN picks up her arm above her head and she guards, so it's definitely fake. That, and she has no postictal phase. When people sees, it takes them a little while to come back down to earth. She just sits up and whines that she's in pain. She shits the bed, on purpose to show me she's in pain, and the PA refuses to order her the Dilaudid she's asking for. She asks someone to help her up out of bed to the bathroom, but I popped into the room and told her because her seizures are so unpredictable there's no way we can get her up without the risk of her seizing again. Bedpan it is. I need to take notes on how to be a successful faker because apparently telling the truth gets you nowhere. The first time I ever got a migraine I thought I was dying. Then when I realized I wasn't dying, I took an Advil, but vomited it back up. Went to the emergency room to get something not by mouth, they refused to give me anything. Funny how there was just an article in our Science about how they don't take women's complaints of pain as seriously men's. Thank you. After telling my doctor about my persistent abdominal pain, he said I didn't have anything wrong and the nurse actually yelled this at me. I found a new doctor, she did tests that showed a large ovarian cyst. She did surgery to remove the cyst and while she was in there, she found my appendix was about to burst. Another doctor had to help with the appendix removal. Afterwards that third doctor called the first doctor and berated him for his carelessness. I guess it was chronic appendicitis that kept getting worse. So yeah, I did have real